Hello, everybody. I'm Dr. Tushar Arora. I'm a senior consultant neurosurgeon at Mohan Oswal Hospital, Ludhiana, and I'm here to talk about dementias. Talking about the clinical criteria and the clinical symptomatology, it is a group of conditions which is characterized by forgetfulness, lack of thinking, and deterioration in social skills, and it also includes agnosias, apraxias, and aphasias. All these symptoms definitely interfere in the daily functioning of the patient, and the major diagnosis is based on these clinical criteria. Now, if we have to talk about the causes of dementias, the most common and most popular cause is Alzheimer's disease, followed by frontotemporal dementias, dementias with Lewy bodies, Parkinsonian dementias, and supranuclear palsies associated with dementias, and normal pressure hydrocephalus. Now, most of these diseases, surgical intervention is not possible, but NPH is one category where we neurosurgeons evaluate it properly and we may take a decision of putting in a shunt. It could be a low pressure VP shunt or it could be a thecoperitoneal shunt. And if the selection criteria are good, then the patients definitely benefit from such a type of surgery. Apart from the clinical criteria, MRI brain would suggest us, give us some indications towards dementia, especially in younger patients. If we can see cortical atrophy, hippocampal atrophy, especially in the temporal parietal lobes and later on in the frontal lobes, then this would definitely give us an indication of Alzheimer's disease. MRI also rules out other causes of dementia like chronic subdural hematomas or neoplasms involving the cortical brain. So MRI definitely has an advantage in the evaluation of dementias. Now, if you talk about the management of such patients, the caregiver has a very important role. His patients, the way he understands the disease, he has to understand that the changes in the behavior of the particular patient is not intentional. It is part of the disease, and the patient himself is not aware of the changes that is coming in his personality. So the caregiver has to be an intelligent and a patient one and has to really empathize with this condition. If you talk about the medical part of the management, there's definite group of medicines which help. The leading group is the anticholinesterase inhibitors, where most popular is donepezil, which is it has been shown in studies that even for a year, donepezil maintains its effect on the patient and reduces the decline in cognitive functions. As compared to other drugs in this group, the gastrointestinal side effects are also minimal, and it is always recommended to give this medicine after meals to reduce gastrointestinal side effects. Second group of drugs, which is glutamate receptor modulators, are also quite effective, and memantine is the leading drug in this group. The main point to remember is that the doses have to be escalated very slowly. It can be started at 5 mg OD for a week, followed by 5 mg BD for another week, and ultimately making it 10 mg BD for subsequent treatment. Behavioral and neuropsychiatric symptoms also need treatment, and psychiatric drugs, the relevant psychiatric drugs, are effective in controlling the symptoms seen in such diseases. The future of the treatment of Alzheimer's is targeted towards treatment of or removal of the neurofibrillary tangles and the amyloid deposition that is seen, and even the use of immunotherapy is in the research, and we definitely hope that in the near future we will have better modalities of treatment so that we are able to do better for such patients. Thank you for your kind attention. Thank you very much.